Yep. Recording in progress. Yay. Welcome, everybody. We're just getting started. We're letting people in. There's echo. Great. We're so glad everybody. Oh, look at this. This is already a beautiful turnout. So grateful to everybody being here on a Tuesday, sunny Tuesday where I am. Not warm, but sunny. So that's great. Um, Welcome to Trauma Training Tuesday. Many of you have been here before, and we're so glad for that. We are super excited today to have Leah and Caitlyn here. This topic, the topic of youth vaping, is something that the community has really been looking for and asking for. I go to a lot of meetings, and people are talking about just observing that this is really a public health concern that, right? People are recognizing that this is really happening. I know you guys have all the data points, but just even preparing for this, it said that youth vaping is the number one substance use problem among youth. And so many of us, like oldsters and even younger people, really are clueless about the scope of the problem, about all the aspects of the problem. So we're really, really glad to have both of you here today, both licensed clinical social workers here to talk about youth vaping. And I'm going to allow Leah and Caitlin to talk a little bit more about themselves and what brings them here. Um, and Leah and Caitlin, whatever you guys want in terms of would you prefer questions to come in through the chat, save them till the end? You can dictate the flow and how you want to do it. But we will probably ask everyone who's not presenting to mute, and I'll just mute myself and hand it on over to to you guys to set the tone and tell us how we're gonna receive the next couple hours of information. Thanks so much.
Yeah, so I guess we'll just have questions at the end. We have like a whole section for questions. And yeah, I'll start sharing the screen. Caitlin, if you want to introduce yourself first.
Okay, great. Hi, everyone. I'm Caitlyn Hayden. I currently work for the city of Framingham as a community health program coordinator. I manage a grant called the Mass Call 3B grant, which was awarded to the city by the state Massachusetts Department of Public Health. And it's around teen substance use prevention. But I've also been in this field for over 5 years now. I used to work in Lexington doing clinical work and macro work around substance use prevention with students over there as well. And that's where I met Leah.
So I'm Leah. I am obviously, as Amy said, I'm a licensed clinical social worker. Just got that title. Woo. And I have been working with youth for about like 6 or 7 years now. I became pretty passionate about that when I was in high school and we learned about the DARE program, which, as I'm sure a lot of you know, is not the best program. So I definitely became a bit more passionate about that because they were using a lot of scare tactics, which I didn't appreciate. So when I went to the Lexington Public Schools and learned about their really great drug prevention program, that's what really helped my passion and helped me learn more about it. So, and I met Caitlin there. Yeah. So, all right, we will get started. Okay, so we're going to talk about the vaping landscape. So what is vaping? So we want to kind of like break it down. So an e-cigarettes are battery powered, non-combustible, not flammable tobacco products that simulate the action and sensation of smoking. So people are using these e-cigarettes to vape. And what is vaping? So vaping is the act of inhaling and exhaling the aerosol, often called vapor, produced by an e-cigarette or similar battery powered devices. So that's just kind of the definition of it. And we're going to kind of get more into what exactly vapes look like, which will be on the next slide. So we kind of wanted to start with kind of showing you what a vape could potentially look like. So if you look in this first picture, you see that it's a bunch of school supplies. So you don't have to necessarily say anything, but I guess if anyone can see if there is a vape in here. And I'll give you guys a second just to kind of look at the picture and see if you can see anything. Okay, so I'm going to move to the next one. If it works. There we go. Okay, so in this next slide, again, it looks like a bunch of highlighters, but if you actually look at the bottom, two of these are actually vapes. So this blue one right here, and then this yellow one right here is a vape. And if you see at the bottom, these are rechargeable vapes, which I will get more into in the next slide. And so they look very similar to a highlighter. So it's actually very easy for someone to hide their vapes. So what I kind of wanted to talk about a little bit is that the DEA program created this program called Hidden in Plain Sight, which is something that a lot of places around the United States have been using to kind of get like parents and maybe teachers and stuff to get an understanding of what vapes look like and how they're kind of hiding, how youth are hiding these vapes in plain sight. And also it has to do with alcohol, and it can do with marijuana use as well. So they would set up these teens rooms, and they would have all of these different types of drug paraphernalia in the rooms to kind of help the parents or help the teachers get an understanding of what they actually look like. So these would be different examples of them. And at Lexington Public Schools, we did that too. And it was really interesting, even for me. And I don't know if Caitlyn, you feel the same, but it was really eye-opening for me because I didn't even know half of these types of paraphernalia that they use. So it was definitely eye-opening.
Before we move on, just want to add this also, the reason we kind of wanted to show this is, one, it's easy to hide. These can go into a pencil case and we would never know. But also, this kind of showcases why big tobacco is selling products that are targeting youth and come in all different shapes and sizes, things that youth are actively using and want to use every day. So this is like a teaser for more parts of the presentation.
Yeah, exactly. Okay, so yeah, so these are the different types of vapes. So on the left, you're going to see the types of disposable vapes. And then on the right, these are different types of e-cigarettes. So on the right, sorry, on the left, it's way more common for youth to be using disposable vapes. They are disposable vapes, they're pod vapes, vape pens, and box vapes. And then over on the right, it would be like, it looks like a cigarette, vape pens, vape pods, box vapes, stuff like that. So these
Yeah,
in
I'm
this
only
section,
seeing part of your screen. I don't know if that's just me or if everybody, but I think it zoomed somehow. So
hold on, let me.
My screen looks good.
It looks
Yeah,
good
mine
on
looks
my
fine.
side too.
okay, so maybe it's just on my end. Sorry about that.
No, that's okay. Here, let me try. Okay. But yeah, so on your right side, these mostly are rechargeable vapes. And what less likely a lot of youth are using, they're mostly using disposable vapes because they can get rid of them quickly. And the disposable vape with a screen is what we're seeing that's most common right now. We'll have more pictures in the next slide, but this one's pretty common. And then okay. So we used a lot of, Stanford has this incredible program where it's like a tobacco prevention toolkit. They used that to help educate youth, but also educate like teachers or people who are doing prevention. They also have an incredible toolkit with marijuana use and alcohol use as well. But obviously, right now we're going to be using the tobacco prevention. So a common misconception that a lot of people think is that cigarettes are actually worse than vapes. But as you can see here, one pod for 90 milligram of nicotine, that's in one pod, that's equivalent to 82 cigarettes in the one vape. And over here, these elf bars, these are way more common now. A lot of people are using elf bars or different types of these like big bars for vapes. And that is 650 milligrams of nicotine, which is equivalent to 590 cigarettes, which is, yeah, it's a large amount. So obviously, as you can see, vapes are way worse than cigarettes and have a lot more chemicals than cigarettes, which we'll get into a bit more. And I know there's also sometimes you'll see vapes where they have like a percentage on them. And so one of them is usually 3%, and then another one is 5%. And on the 5% vapes, that's usually equivalent to 90 cigarettes in the one vape.
Okay. So I would like you all to, you can either yell it out or type it in the chat, but what percentage of high school students do you think have ever used a vape or an electronic vapor product? Yeah.
Lots of answers in the chat there.
Yeah,
Wow.
those are good answers. Leah, you can go ahead and click again. So in Massachusetts, this is from one of the most recent health surveys that are sent out to high schools. I think it's a random selection of high schools across the state, but that survey results have found only about a quarter of students have ever used a vape in their lifetime, and about a tenth of students have used a vape product in the last 30 days prior to taking that survey. And this is really important. This is just an important note for us to recognize as adults who support and care for youth in the state. When we believe that all students or most students are using substances or vape products, we're developing a social norm, and we're normalizing the fact that everyone is going to use a vape at some point in their life or actively using. And so and even our youth are believing that their own peers are going to be using substances. And so when we try to shift this narrative of changing behaviors, that it's not normal to use at this age, it's not normal to continue using, it's important that we start believing in the data that is being pushed out there and helping our students believe it as well. You can click. So these next couple slides are just going over some demographic data from the students who said that they have tried a vape or have used recently. Just super high level, as we move up in grade levels, the likelihood of someone having used a vape or actively using a vape has increased. We are also seeing females tend to be using more often than males. You can click again. And students that identify as LGBTQ, Hispanic, Latina, multiracial, are also more likely to have used or ever used in their lifetime. You can click again. Thank you. Click again. So as we think about all the demographic information and why it targets certain populations, where this all kind of all these pieces kind of come together as we move forward. But in general, when we discuss nicotine tobacco use with this age group, it's really important to address all the misperceptions as well. A lot of times, as Leah had already mentioned, people believe that vapes are better than cigarettes and that it's just water vapor. But we know that the the chemicals in the e-liquid or the pods contain a lot of metals and chemicals that then are released into the air and right back into our lungs. And we already saw how high the concentration of nicotine is and how concerning that is. I think I saw a question of like how quickly are students going through these items. I personally don't know the information on that, but I would assume it's probably a lot quicker than going through a pack of cigarettes
I,
because
I
it's
would
just
say,
right there and available.
sorry, Caitlin. I would say
Go ahead.
usually like I would, from my understanding and like personal experience, I've seen people usually go through the vapes in like a week or two. It's pretty quick.
Yeah. And it depends on this, I think, on the item and the student as well. And we're going to touch on why someone might be choosing to use. So when we understand what that trigger may be, you can better understand, how often they're seeking to use that substance. As we know, using tobacco and nicotine may cause lung and heart diseases. And some people have believed that using e-cigarettes as a form of quitting other tobacco products is helpful, but the FDA has not found any of these to be safe or effective. You can go to the next slide. Thank you. In addition, the reason this is a little bit more concerning is the teens, their brains are still developing. Our brains don't develop until we're like at least 25. And the last part of our brain to develop is the prefrontal cortex, which is our decision making and impulse control center. And we know teens, making proper healthy decisions. It's already hard enough with all the stimuli that's and stressors in their life. Now we're adding in substances. And so nicotine, when consumed, floods the brain with dopamine, which is our pleasure and reward chemical, letting us know, like, I like this. This makes me feel good. I want to do more of this. And so the more you consume, the more your brain releases dopamine for that stimuli. It starts training the brain saying, yes, I want this. I want more of it. And you start developing a new baseline for that. And so when nicotine is used often enough, you're then becoming more reliant on that item to feel that feeling. And so the results of that can lead to every other activities, going to school, attending sports, hanging out with friends, may start to feel less rewarding and satisfying. And also, since our brain is still developing at that age, it can also affect attention, mood, and learning as well, which can lead to other forms of stressors and reliance on and going back into using substances. You can click again. There are also environmental concerns around this. We've seen reusable and disposable vapes so far, but there aren't any policies and proper ways to dispose of vapes. And so a lot of people are just throwing them in adults and youth are just throwing them in the trash, in the normal trash. But because they contain lithium batteries, there's so many chemicals in that, it's going back into our environment, into our ground, into the water. Animals can consume it and can cause a lot of harm as well. You can continue on. So this data point, 30.9% of high schoolers reported that their mental health was most of the time, or if not always, not good. And so we know that mental health is a real concern of youth nowadays. They're very cognizant of their mental health status and what's causing positive influence versus negative influence. Some youth rely on substances or vaping to cope with the stressors of life. And that kind of reinforces a negative reinforcement. But there is also information out there that says the youth who are vaping have also are 2 times as likely to recognize symptoms of depression. So the act of using is temporarily relieving some negative mental health stressors, but down the line, it can lead to more serious mental health concerns in the long term. And I just mentioned this because it's important when we talk about prevention. Youth do want to learn about this. I think they don't want to have a lot of the conversations because they're fearful of being in trouble. But when we really set the tone of, we understand that, there are hard things that you're experiencing, and there are ways that we can cope with that are much healthier for you. They're going to understand that, and they're going to recognize that. I think both Leah and I both had times offering clinical care to students who were caught using on campus, and those are the basis of our conversations. And because mental health is such a concern of theirs, when we really set it home that it may relieve stress now, but long term it is not going to, it helps shift their decisions to change. And then I have a lot of conversations with youth back then, now, and the folks that support them around building their coping basket. We're really good about having conversations of, after a long day, I just want a nice hot shower to relax, or I want to treat myself to a sweet treat. And that's a really good way to have coping built into your schedule. But what happens when you're in immediate stress, or you're taking that math test that you thought you prepped for, but now you're sitting in front of it and you're scared? What do you do to ground yourself, and what are your techniques to relieve that stress so that right after the test, you're not going to go, behind the school and vape, or whatever the coping mechanism is. And so starting these conversations early is helpful, or I have found it helpful for students. And we'll be sending some information out at the end of this as well. You can press the next slide. Is this me? I can't remember.
Wait.
I think it's you, actually.
I think it is me. Okay, so what flavors of tobacco or vape products do you think are sold in Massachusetts? If you want to go in the chat and say, and Caitlin, I don't know if you want to read them because I can't see them.
I can read it.
Thank you.
Okay, we have fruit and candy, mint or fruity, strawberry, more fruit. Someone said that they're not allowed except in smoking bars. Every kind of single flavor is available. Mint. All good answers.
Great. Okay. So, back in 2020, Massachusetts actually prohibited the sales of flavored tobacco products. But tobacco industry is very sly, and now they are selling like non-flavored products like clear, chill, or smooth, which they're saying doesn't have any sort of flavoring in it, but it typically does. So oh my goodness, the Math Youth Healthy Survey asked students what flavor their tobacco products contain, and 8.3% said fruit, alcohol, or candy flavors, and 5.1% said mint, menthol, or wintergreen flavors. So where are the youth getting the flavored products? So before we get into where they're getting them, these are just different other examples of the different types of vapes. So as you can see, there's some that say clear, and then I would say probably like this, and Crave Plus is pretty like the most common that I've seen with youth. And to the right, with like the Zyn pouches, these are just nicotine pouches. We're not going to get too into it, but I wanted to say that a lot of people have tried to, when they're trying to get off of vaping, they will use these nicotine pouches, which are actually just as bad as vaping, and they're actually really bad for your teeth. So that is a common misconception as well. We'll definitely talk more about how to help with quitting vaping and stuff like that.
Can I add? Sorry, Leah.
Oh, yeah.
So this photo is actually taken of actual materials that are being sold in Massachusetts. One of my colleagues works as a tobacco inspector of sorts, amongst other responsibilities. And so these are products that are actually being sold in adult-only retail stores. And in some communities, not every community has gone through this process, but some of them have been assessing these products for whether or not they are termed flavored. And if that community determines that that product is flavored, the hope they'll be removed from that community. And so we'll talk about other ways to get involved, but this is something that you should be cognizant of in your own communities and whether or not these products are being determined if they're sold or not, if they're allowed to be sold in that community.
Okay, so now we're going to get more into like the advertising of vaping. So I first want to talk about the upper right hand. I know y'all in the chat kind of talked about the different types of flavoring, but I mean, if I were a youth and I saw these different types of flavoring, I would also want to try vaping, like the apple grape or the blueberry ice. Like this sounds like really great types of flavoring. And so these are just one of the many examples that the tobacco companies use in order to entice youth to entice youth to vape. And same thing, like this is a young person vaping, you see in the advertisement. And these are just kind of different types of like cool advertising. They use different types of colors, like pretty colors like this. Um, and we'll get more into the social media a little bit because that's definitely a really big aspect of vaping. But before there's in like movies and TV shows and stuff, there's a lot of celebrities vaping, or in those movies and TV shows they're vaping, and it's pretty normalized. So youth will look at that and say, okay, this sounds pretty cool. Let me try vaping. And like maybe their favorite celebrities are vaping as well on social media or on anything on movies and stuff like that. So it's definitely seen as very normalized. Um, and we also wanted to add too, I know back when like cigarettes were a big thing, they really they targeted like Black and Brown communities and LGBTQ communities in and they're doing the same thing with vaping to kind of advertise to those specific communities. I know like me and Caitlyn were definitely talking about this. When I go to Pride every year, I didn't even realize, but there are vaping organizations that are trying to sell vapes like at the Pride events, like they have their own little booth. And I didn't think anything of it, but then realizing there are kids walking around all over, and Pride is obviously like a whole family event and it's for everyone. So it's just crazy to see that they're trying to sell vapes while there are like kids walking around again to normalize it. Um, and then we kind of wanted to talk about like tobacco and vaping within the like social media. And I kind of touched upon it. And I know specifically like the Truth Initiative is incredible and they have a lot of great resources. We referred them at the end of our slides because they just have such great tools. So this is one of their tools. And over to the right is a meme from TikTok. I wanted to use an example. So like I said, youth are seeing a lot of like advertisement on vaping, but they're also seeing memes to kind of normalize it. So for example, there's this meme going around that if you have a vape and you lose it, like people are scrounging, destroying their room to try to find their vape. And I've seen that I've seen that TikTok like a million times, and people write in comments like joking about it and stuff like that. So again, we're kind of normalizing it, and acting like it's like what people do in a day to day. And then, so we also kind of wanted to talk about like how youth are finding these vapes, because obviously you have to be 21 in Massachusetts in order to obtain a vape. And so we've noticed that a lot of kids are actually using social media, like maybe Snapchat maps or potentially TikTok, but mostly Snapchat we've seen, where people will advertise it on there, and then you can just chat with them and they will bring it to you or sell it to you over that. We've also noticed that people or youth are going to different states like New Hampshire or Maine, where they're able to purchase the vapes. Maybe they have a fake ID, or maybe they can find like a company who will give it to people who are under 21. And then we've also noticed that a lot of people are going online and buying vapes in bulk. And some, for the most part, it is hard to get vapes online, but there are certain websites where you can actually buy a vape, and it's quite easy to do it. You just need an ID. And so they'll buy it in bulk, and then they'll go to their school and they'll sell it there to their friends or their peers and stuff. So it's pretty crazy. Okay, so we're going to talk about prevention and strategies. So we're mostly going to talk about peer pressure. So according to the CDC, the most common reason why middle schoolers and high schoolers are vaping is because of their friends are using them and they're peer pressuring them into trying it. So it's about 32.3% got them from a friend, 31.1% bought the products themselves, and then 28.7% let someone else buy the products for them. So like we talked about. But this was a big thing when me and Caitlyn were talking with youth and like counseling them on peer pressure. So we talked a lot about different ways to say no, or different ways to get out of different situations. The biggest thing I thought was super helpful for the youth was kind of coming up with either some sort of plan. Like, let's say a youth is out and they're at a party or something, and someone's offering them vapes or different types of drugs, and they're feeling uncomfortable about it. So they have this sort of plan where you'll have your mom text you if you send them an emoji, and your mom will say you need to get home now. Or you'll have a sibling that has a car or something, so they're able to pick you up. So it's just kind of coming up with some sort of plan. That definitely helps them a lot to kind of have like, okay, this is like a plan B if something goes wrong. And then we would tell them like maybe saying no with confidence. Like, I'm not into that. My parents would kill me if they found out. And we also talked a lot about like finding the right friends. Like, is it really cool if your friends are peer pressuring you? Like, you shouldn't really have friends like that. You should be having friends who are encouraging you and giving you positive peer pressure instead of negative peer pressure to try using vapes. And a lot of the youth actually liked them making a joke. They thought it was funny, so they would come up with like different types of jokes to get out of the problem that was happening. So we also thought it was important for like maybe parents to talk with youth. I think this is really important to kind of help parents understand like how to talk to them. So before you're talking, make sure that you know the facts about vaping, and that you talk in an open and calm approach and come with empathy, definitely. And finding the right time and place to talk. I know Caitlyn mentioned earlier that like these youth are scared. Like they're scared to talk about vaping because they're so worried that they're going to get in trouble. So if you come to them and you open the conversation to them, it helps to ease the conversation and helps to ease and let them be like, oh, okay, maybe I can talk to my parents about vaping. And so while you're talking with them, asking for their perspective, like maybe they might have gotten in trouble for vaping at school. And it's like, okay, what happened? Like, how did we get here? Like, how are you feeling about it? And I thought this was a really big thing. Blame vaping companies and not your child, because your child is trying to figure out, trying to get through middle school and high school. And I'm sure like we've all gone through this like struggle of middle and high school. So just like them trying to feel accepted with their friends and society and stuff like that. So I thought that was really helpful. And then avoiding the scare tactics, like I talked about with Dare. The scare tactics is really important. Like I said, like these youth are scared to talk to you about them. So just coming in with like an open and honest discussion is super helpful, and connect with what they care about. And then after you talk, I think is pretty important. And I know Caitlyn talked about like coping skills and stuff like that. So kind of taking like that coping skill toolbox and being like, okay, what can we do instead of you vaping? And like, here are the different types of tools that you can do, and kind of coming up with some sort of safety plan with them, or some sort of like coping skill plan with them. And then as always, like following up, like checking in with them, seeing how things are going, is really important. And just keeping the conversation going and keeping the conversation open is really important too.
So this is just a quick like items that it could be helpful for parents, caregivers, or even other supporting adults for youth. So the CDC created the Free Mind campaign. It does talk about opiates, tobacco, and alcohol in this, but there's a lot of pamphlets and information and like infographics on there that parents can refer to and use when they have these like early stage conversations with their teens regarding substance use, and it does connect well with mental health. Um, the Parents Against Vaping, e-cigs, PAVE, is another organization that offers free webinars. If you go on their website, they have a lot of information similar to the conversations that Lia and I have shared today, that they put on nationally. They also created another campaign called Vapes Are Trash that talk about the environmental effects. I have also listed NAMI, Massachusetts, the Compass Helpline. This is a service that they offer for folks who are trying to figure out navigating the mental health system. So they can offer resources and support on where to go to find information or who to contact if you have someone in your life that you're concerned about. I have also included the substance use helpline and smokers quit line, and then another nod to the Stanford Reach Lab tobacco prevention toolkit. So that is free, and we'll be sending out all these links. But that is a free resource. They have fully planned out curriculums and flyers and presentations that if you're just trying to educate yourself on, great resource. If you're trying to have a new part of your health class or a conversation in a program that you're having with teens, this is also a really great resource. They do offer trainings, like quick webinars on how to go through their toolkits as well on their website. You can click on the next slide, Leah. I also wanted to include some specific resources for teens and young adults. Hey, if you're unfamiliar, Hey Sam is a texting helpline run by young people themselves. So it's managed and organized by young people, and they are also the ones that are on the other side of the texting line. So teens, I think it's 13 to 18, can text this number and have conversations of mental health support. If you're unfamiliar with Headspace, it's a really great meditation app. High schoolers get a free account. So this QR code brings you directly to that registration page. I believe they just have to sign up with their school email. And so I think some schools in different parts of the region have a Headspace collaboration, so that might uh, speed up the process. And then all of the links on the right are other apps developed by Massachusetts, developed by the Truth Initiative, and other related resources, again, for texting and support on navigating mental health and substance use, as well as other hotlines. And you can click the next slide. I also wanted to highlight there are other ways to get involved in prevention that aren't necessarily, you know, in a classroom setting or in a program setting. A lot of organizations that I've seen that I've worked with in my own role now are having youth coalitions. There are youth that want to be active in addressing the health and wellness of their peers in their communities, and there are organizations that support that. And so a couple of them are like the 84 movement, which is it was developed by the state Department of Public Health. And this is specific on tobacco prevention, and they offer any youth, if there's already a youth group out there, you could just send an email to sign up to become a new chapter, and it doesn't necessarily change the whole like ecosystem of your current youth group. But the 84 organization offers free webinars and trainings to youth regarding tobacco and all of the other factors related to that. They do offer really cool webinar on race and racism and how that affects the tobacco industry and targeting youth as well. Then there's SAD Club, Students Against Destructive Decisions, Hope Squad. These are just other organizations. The challenge with youth coalitions is that they all go by different names, and so it's hard to find them and support what they're doing. But a lot of times they can be connected to public health departments, youth and family services, a YMCA. It could be a school club, for instance. But I'm the only reason I'm sharing this is that it's important to uplift youth who want to have these conversations and provide more information about how they can get more involved in decision making around in their community and in the state. And then additionally, many communities, we can see this at the bottom point, many communities across Massachusetts are interested in having conversations and passing the nicotine-free generation policy. And this is essentially a policy that essentially phases out selling tobacco products in that community. So if that community decides a specific date, if you were born anytime after that date, you're even if you're 21, no longer able to buy tobacco in that products or vape products in that community. And so as the folks that are born prior to that date leave that community or age out of that community, the products are slowly, no longer able to be sold in that community. So it's a really interesting policy. So if you're a part of a community that has passed that, that's great. If you're a part of a community that's having early discussions around that, I urge people to kind of educate themselves on this as well. And I think that's it for questions. And then unless we want to make sure we had time for questions for people, because I know this is a pretty high level start to this conversation.
Yeah.
So great, you guys. Such great information. I did see a question about, I'm sure there are questions. I hope there are questions because we have plenty of time. Not that there's any harm in ending early, but somebody asked about if you know, and I don't, about addiction resources for young people, like an inpatient setting. Do you know if there's any place that does?
I don't know, I can't name anything directly, like offhand, but there are places that are recovery centers, recovery high schools, and I can include that information into like a one pager, as long included with the slides that we have now, um, that are out there. I do believe a lot of recovery high schools do not necessarily take mass health, but I think
They're
there
funded
are.
though, right? I don't think you have to self-pay. At least, I mean, I know a little bit about Recovery High School that Worcester used to have one. I don't know that they still do. I think the form, it was how it was envisioned would be like it was a specialty school that you could opt into. And I don't think they continued because they just didn't have enough students that wanted to go to a recovery centered high school. Um, it feels like resources go away way more often than they come on board for youth and especially around substance use. I don't know. I see that Sarah's here from Wayside. I don't know if Wayside has anything or if anybody else knows about resources there are if somebody needs it at that level. Please feel free to jump in, anybody who might know. I know we have some providers on the call right now as well, so I'd love to hear what people are doing or what's coming up.
I have a quick question. Good afternoon, everyone. So, um, good job at this level, bringing awareness for kids, making sure they're well informed, making sure they're well educated. Good. Now, what's the efforts at the policy level? So everything I think for me boils down to the policies enacted or placed in, or policies in place for things like this. So I would assume from a cultural standpoint, maybe we've learned something from what cigarettes used to be in the 60s and the 70s, the science research and everything that goes into it. Vaping is actually it's a lot more open than that. I mean, the literature is clear. It's destructive, even in ways which we're only beginning now to understand, at immediate level, genetic level, and things like that. So, what's the efforts at the policy level to bring that awareness? So, yeah, in the context of freedom, a free movement to have things sold, but where do we balance that act in terms of policy and the destructive nature of products to the most vulnerable in society? So, is there any efforts at that level? Just curious.
Well, at the state level, I think one of the main policies that really started this is, as we had said, the prohibition of selling flavored products.
Mhm.
You know, obviously there's loopholes. Big Tobacco they have a lot of lawyers on their
Yeah.
side, so they're able to kind of keep up the pace compared to public policy making. But I think a lot of having individual communities address what is being sold in those communities is helpful, especially when it comes to flavored products. Now, also urging communities to create more inspections and policy enforcement is helpful. DPH has a program out there where there are regional, like as I mentioned, I have a colleague that does like tobacco inspections as one of his roles, but I mean, in the grand scheme, that's a very small program across the entire state. And he covers 16 communities. That's his region. And with over, I can't remember, but 300 retailers. So that's an insane amount of people and retailers to go in and say, okay, here are the updated policies. Reminder, you can't be selling to people under 21. Are you checking every time you see an ID or to see an ID?
Yeah.
What are you selling? So these are the conversations. There's a lot to do. And I guess the bottom line is what I'm saying is there's still a lot that we can do on a policy spectrum, but it's really important to recognize what are the policies in your community, where are the gaps, You know, what's the retail density? Are there a lot of shops selling tobacco and vape products in a certain area in your community that might be especially susceptible to tobacco marketing? Um, you know, how can we create new social norms? A concept in the community that like I work with is we do a lot of around we're trying to develop like social norms and positive community norms. And that's about the reframing of the conversation. You know, as I had mentioned early on, like not everyone is using, I mean, it's still an alarming number. It's a quarter of our student population, but not everyone is using. What are they doing instead? You know, how can we create these basic parts of our society having conversations that promote the positive sides of health and wellness and being versus specifically focusing on the negatives. And the more we educate, the better we are at policy enforcement. Leah, I don't know if you want to add anything else.
Yeah, I mean, I just want to add to like, I mean, also like talking with your state representatives too, like always like telling them like trying to get some bills passed, like even if it's only in like Boston or only in like Worcester or stuff like that. But that's even though it's small, it eventually snowballs into something big. But I think like the biggest thing that we learned when we were at Lexington and that we like really emphasize is like educating youth the most because the youth are the ones that are using vapes the most. And so educating them will help prevent it. It's like the same thing back in like before vapes became a thing back in I think like 2011 or something, and we were like this close to getting rid of cigarettes, you know, because like people in like my generation like didn't really like cigarettes, so we were almost there. So I think it's just like Caitlyn said, it's just educating them so eventually it'll fizzle out and hopefully nothing new will come out.
Yeah. Yeah, cool. Thank you.
Good point, though. I feel like that is what we're up against is part of the reason we wanted to have this is we're not knowledgeable about and just hearing like, okay, flavored is against the law, so they go around it. Like they just figure out the workarounds and the profit motive is so strong um, that it feels like you really do have to keep on top of it to make it change. Like I appreciate you know, the comparison to tobacco and cigarettes and thinking about how long it took us to really, it probably took us a good decade to be onto the fact that they were bad for you.
Yeah.
Right? So you got a whole 10 years of people doing it. And then once we started to be onto they were bad for you, like then that took another 20, 30, 40 years to get close to extinguishing it. And it's a little bit heartbreaking to see that they've found this new way to target young people and it's working. Like
Mhm.
young people don't, I think young people really don't recognize how health harming it is because they've tried to sell it. That was, you know, the beginning of cigarettes. They used to have one out of three doctors recommends this brand. Like they're like blatantly lying about it being health promoting. And so it's hard to be one step ahead like that's what we're up against. They have the resources um and hopefully we have the numbers, but when people don't even really know what the problem is, they're so good at it. I'm still stuck
Yeah.
on that highlighter being a vape. Like,
Yeah. And I mean,
wow.
I would encourage you to go to a vape retailer smoke shop and
Yeah.
walk around. I mean, so those are adult only stores, so people only of age can go in there. But you can see all the products that they're selling. I mean, I've walked around and there's some that have portable speakers on it. So you can
Yeah.
vape and it connects to your phone. There are some that look like gummy bears. And so you have to like it begs the question, like, why are we selling novelty items like this? If the people who are most likely going to be most excited to see that are teens or are young people. Um, and then, you know, questioning whether or not is this retailer actually following all of the policies. can these items be sold here? Are they actually checking every single ID? So it's scary, to put it lightly.
I just want to voice, if I can, like we're really focused on retailers. I run a young adult program, and I had an 18-year-old constantly with the vape. So much so I have a bag full in my closet because we would just confiscate them. It's like, you're not old enough to have this, and asking them where they got it from, and it's not, they're not indicating a store, they're indicating people, right? Or as they put it, they're connects, right? And so is easy for us to be able to, in some ways, identify a store that may be the challenge or the issue. But how do we also get to the people? Is kind of the marijuana situation once upon a time of like, how are you actually getting this? We can't pinpoint it, and it's happening in our communities as well.
Yeah, that's a challenge that I've heard in some of my colleagues in other communities as well. Um, that, and as Leah had mentioned, social media is really a popular way to advertise that you may be selling a product, and that you're potentially willing to sell to someone that's underage. And I mean, as someone on Snapchat, you're not legally allowed to be selling, secondhand a product. So that's another issue as well. And so I've seen that social media really like glamorizes items like this, and word of mouth is very easy to share information on who's your buddy, that has products that they're willing to sell, or like going across state lines to get a flavored product too. So I don't know. I think continue having those conversations with your young people about who their connections are, and having more conversations around safe relationships on social media might be a good route around that. I think it's tough to enforce what's happening online, but in theory, it's easy to enforce, proper and healthy decision making when interacting with social media.
Yeah. I too, like when I would talk with youth, they definitely would not talk about where they would get the vapes, or they would kind of like keep a secret with it. So yeah, I think the emphasizing on the some sort of restriction on social media. I mean, I know that goes into like parenting and stuff like that. So, but I think like that could be very helpful too, because that's definitely where they're getting a lot of it.
Hi, my name is Echo. I'm the Executive Director of 508 Chairs. Thank you so much for sharing all of this. I know a lot of talk is being talked about, like policy level, federal level, and state level. However, I work with the youth, and I was just at a large like youth equity advocacy event over the weekend, and the thing that we're actually hearing from the youth is they're looking for more interventions at the school level. And what I mean by that is two opinions came out from the youth. That the discipline isn't really there for vaping, when it happens, and that when it is there, it's more severe for athletes versus non-athletes. So we're prioritizing athletes and their ability to participate in sports over just vaping in general. And the youth who have, openly talked about, vaping or participating or getting caught and having, either discipline or not, they did express that the ones who did have to go to some sort of program, like a week or two, that was educating them, that it was very helpful, and that they learned things that they did not and they were not aware of. So another thing we can be doing as parents at our school level is asking what is the enforcement and the support behind this, right? Because this is a health crisis. This is also a mental health crisis. So we are required to support and educate and inform, and discipline is not the way, right? We have to look at this kind of like rehabilitation and support. they're not making smart decisions. They're youth. Their brain's not wired to make those type of decisions. But when the decisions are made, coming in with support, information, and that stuff, according to the youth, because I'm a fan of, making sure the people who the policies are being made about are brought into the decision making and the table, because we'll realize, things that we're missing out on. So I think at the school level, support and programming would definitely be valid. And we have to be cautious of the messages we're sending that athletes are more valuable than students and that we're giving interventions or chances or whatever with athletes but not with regular students, and that is bothering, that's troubling to me. I'm a mom, I'm a coach, I have serious athletes, but just looking at the inequity of that and the message we're sending youth, I think it's inappropriate. And if we all just speak up at the community level and address our schools that our youth are in, or the areas that we can get the schools to have these interventions and supports, which are currently, not available everywhere, but where they are, they're definitely working. And that's from the mouth of youths.
Yeah. I mean, me and Caitlyn, like, we are part of an incredible program at Lexington Public Schools where youth would get like suspended, and instead of suspension, which I think is ridiculous, and I could go on a rant about that, but when youth were getting in trouble for this, they would come to us and we would educate them on vaping, on marijuana, on alcohol, and it was such an incredible tool for them, and just to help educate them was the most important. And then we've like what I've seen working with youth and like what we saw at Lexington Public Schools is we would always have like youth being empowered and making their decisions, and advocating for like drug prevention and educating younger children, like high schoolers would educate middle schoolers, and middle schools were to educate elementary school kids, so like giving them that power and giving them that advocating was extremely important and like very helpful for this type of work, and honestly any type of work related to youth. So
Yeah, and the students that were a part of our like counseling program were allowed to be in the program where they did the peer education as well.
yeah.
Which I think puts back the power, like, you messed up and we were learning about that, but you can then, turn this into something positive and tell your younger peers what are the harms and risks of participating in behaviors like that. In addition, to talk on the school part, a lot of schools, there are policies out there, but each school does also have their own strategy to address if a student is caught using on campus. And so that's a really good question to question and ask as parents and caregivers or people who may be somewhat related to a school system. What are your strategies? How do the staff members recognize a student may be using? Who do they go to? What are the steps? We want to know. I think just to add a layer to that, I was just at a training where some other teachers were at, and a lot of them, they don't want to assume to cause harm. Like the student may be in a household where smoking is normal, and so they come to school smelling like it. And so if you're going to, assume that they're also using, that can cause harm, and that student may not ever go to you. So there are these nuances it's hard to address. And so that's a conversation more on school administrators and how they're having conversations with their staff on that. I would also urge, as you question what are the systems for schools, who are their connections in the community, or in the region. If a student is caught using, who do they reach out to have conversations? How does that student if they have to leave school for a certain amount of time, what is the plan to re-enter? And re-entered into the environment that may have brought them to use, or around peers that are using, to encourage that as well.
Leah and Caitlin, I know we were sort of talking about it as we were starting, but we were talking about the how much nuance there is in this topic, right? And um, Leah, I appreciate you brought it up about the DARE program, right? The DARE program, we really did start with the assumption that giving kids as much information as we possibly could was going to be useful and healthy, right? And Kelsey said, well, that is the formula when we're talking about mental health and suicidality. We want to make sure youth know that we have an open door policy. We're ready to talk about this stuff. But when it comes to substance use and substance misuse, there really can be TMI, right? Like it really is a situation where knowing a lot more about different ways to get high can be harmful to young people. I don't know what, if the Lexington program had a level, like had some guidelines for like how to talk about it without, and you guys said it too, like without assuming that kids are doing all kinds of things that they may not be doing. But if you could speak more to that, that would be helpful.
Yeah. I know like when we were talking with youth, we wouldn't give them any like specific things. Like, I mean, I know I talked about like Snapchat map, but we wouldn't necessarily talk about that. We more just like educated them on like the use of vaping. And I know like I would talk about you like I'm sure y'all know about the show Euphoria. It's like heavily has vaping use in it and drug use and alcohol use. So that I would use like that as an example, but I don't think we would go too in depth of like, oh, like who are you getting it from? Or like, here are different ways that you can get it from. Instead, we would kind of split it. So when talking with youth, we would have different discussions of like, okay, here's the education on it. Here's about peer pressure and like how we can prevent it. And then when we talked with families, we had like different programs with families where they would come to us and we would educate them on vaping, and also we would educate them on like hidden in plain sight like we talked about, or we would educate them on, okay, your kids could be getting it from X, Y, and Z, so we kind of separated it, just to make sure no one's using it. And Caitlin, I don't know if you.
Yeah, I would just add that having the conversation about how it affects the body and the brain is very useful. I mean, when we started these conversations with youth, it's a lot of times, oh, okay, like what were the circumstances around your use? Did you bring it? Did you use it because someone else brought it? Kind of understanding the circumstances. So they may have just been caught because they were just passing it around in a circle, behind school. So it's a matter of circumstances and convenience in that specific instance. But and then you ask, like, do you want to use again? Is this something that you're interested in? And have getting an understanding of what is behind their decision making, and what are their chances of using again, and recognizing why they may want to use again, if not, sometimes it could be a one and done situation. Exploration is very common at this age group, and we know that for marijuana and alcohol as well. And so having the understanding of what that does to our brain, why we're making these decisions, is very helpful. And we've already talked about how going into conversations openly, you don't have to start the conversation like, are you vaping today? Are you going to vape tomorrow? It could just be, how is your day? What's causing you stress nowadays? And then going into the conversation, okay, like, what are we doing? You're stressed. You're stressed about math. So I'm always stressed about math. That's my only example. Why are we, what do you do when you're stressed out during your math test? And then having that, and then that can then lead down, like further down the line, conversations around substance use. I remember I think Leah, you also had these conversations with parents that, people who are over 21 can smoke. I grew up in a household where my grandma smoked a pack a day. I mean, I love to hang out with her, but I don't want to participate. Not that I don't think she would let me, but either way. Um, uh, but that's normalizing cigarette use in the household. And so how do we have these conversations with our young people who may be in a household where that is normal, and like how to work around that and what are the dangers of secondhand smoke? You don't want to exclude yourself from family gatherings, but the next time you have a barbecue, what's going to happen? Or at graduation when, cigars are being passed around. So having these conversations and prepping these youth for these potential events in their life where this could happen preps them for proper decision making as well.
I also too want to add to that, like we didn't talk a lot about like parents vaping or parents smoking cigarettes or drinking alcohol or marijuana. But when we worked at Lexington, we definitely talked about, like Caitlyn said, secondhand, thirdhand smoking, and how it affects them. And we talked a lot with youth of how they can talk with their families too, of like how this isn't really great for me being around it, or like um, with like prevention around that too.
I think I saw a couple questions in the chat.
Yeah, I was just gonna say, Karen, you had some really good information in the chat. If you're comfortable, we'd love to have you jump into the conversation and ask your questions and make your observations.
Um, sure. One of them was, so we went to a hockey game at a college, and they go through the metal detector, and then they like just go through your bags. And so someone in our party had their vaping paraphernalia confiscated. I I didn't really get into like why did that happen, or is it illegal to take it? Like would that happen if you had a pack of cigarettes, or is it something different? I have no idea. I didn't really ask, but I didn't
Yeah.
know if anyone knew.
Yeah. So I don't know exactly the laws, but my understanding is that you are not allowed to have you're not allowed to use cigarettes or vapes within like a public area, in a sense of like a hockey game or like a concert, like if you go to TD Garden or something like that. Like I don't know how big the regulations are, but I know within the last 5 years they've changed the regulations to emphasize on vaping. And I know obviously if they're going through like a scanner, they're more likely to confiscate it. I don't know with cigarettes, obviously. That's like
Yeah.
less, it's harder to confiscate that, but it's easier to smell it when you're in the area. So,
Oh, absolutely.
yeah.
The other thing I just said is, I think everything needs to start at the home level in general, but not everyone has that ability. So the school level is great. Um, I always feel like kids, whether it's my kids' friends or even my own kids, especially their friends, when they're with them, if you have them like, their undivided attention in the car, I love to ask them things. Um, I don't ask them like, are kids drinking? I sort of catch them off guard and I say, hey, how are kids sneaking alcohol into parties these days? And or I'll say, you know, so do you guys hear a lot about like kids your age having sex? Like seriously, like almost like I'm nosy. And but in a funny, not in a funny, it's not funny, but you know what I mean. I assume that it's happening. Um, or so who's selling drugs at the school these days? And then they all know. But they'll some of them just want to tell you. They want to tell you what they know because then they're in the know. Um, it's the same thing with like, well, it's off tangent. I won't say that, but I'm just saying like I try to just ask these questions and I found out exactly how kids are, it's not rocket science, but how getting alcohol into people's homes and um, you got to go this way and put it in this bush but it's the same way with vaping. Like, hey, are any of your friends vaping yet? Taking it off of them. Like I'm not asking, are you vaping? Um, and I have found that they'll they will tell me, I think, because they confirmed it, and it's just one way to approach it.
Thank you so much, Karen. And that's the protective factor for like everything, every youth risk. The protective factor is having adults in your life that you trust, that care about you, that aren't about punishing you, that are, genuinely there for you. And that's going to make it much more likely that kids have healthy outcomes. So definitely that's amazing advice, is to just be the person that has these conversations with young people and has them in a way that isn't punishing and judgmental, but in a way that's open and allows for them to be honest. And I think you said it, and other people may have as well. I think youth really don't want to harm their health. Like they genuinely don't necessarily know the risks of it. They, right? Like the when you do that risk benefit analysis with them, I think they really can come to the conclusion themselves that it's not worthwhile.
Mhm.
Mhm.
Vaping is an issue in our family. We have an adult daughter who is a big vapor. Um, it's bane of my existence. So. And she's not allowed to vape at home. But I don't say you can't vape at home. I say you can't vape in the house. You can stand outside the front door. You can go in the garage. You can go on the deck. I don't care where you go, just not in the house. And I think that's the way to, because they're not going to listen to you anyway. If you tell them not to do it.
Good way to protect yourself and set limits for you about what's okay in your home.
I
And we
once
all have the
found
right
all
to
her
do that.
vaping stuff that she
Yeah.
didn't take back to college, and I just sent a picture and said, "Do you need any of this sent to you?"
Oh,
Just
that
to
was
catch her
nice.
off guard. So, I
Um,
mean, yeah.
I also saw the question about the Lexington program that both of you went through, and kind of, is that available to everyone? How did Lexington come to kind of take such a strong stand and put resources into it? I'm pretty sure, and Echo might know much more about where Worcester's at in terms of resources and getting this kind of information to parents and teachers in our schools. But anything that you can offer that would help at that level of, I know people in this audience are, engaged with their schools and engaged with youth. And so if you have some good a roadmap for us to help our schools, help our young people, that would be great.
So, Amy, if anyone is interested in joining the Worcester Anti-Vaping Task Force, that is a task force that I am on, you can feel free to email me. I can absolutely get you connected. My email is echo, at 508cheers.org. Secondly, we did produce a very extensive parent survey that we are looking for participation in. Actually, Amy, if it's okay with you, I can grab it and throw it in the link. I mean,
That
in the
would be
chat.
wonderful.
But we're
Absolutely.
not
Thank
just
you.
looking for, parents to do it. We're also looking for you to share it on your social media sites or into schools. The more information we can get back, the better. We did spend a lot of detailed time coming up with these survey questions, input, thinking about, what's appropriate, what's inappropriate, what we were looking for in responses, and the information we were looking to gain. So it is very, very thorough. And again, we're always welcoming participation from people who want to join their virtual meetings generally. And we have a lot of stakeholders like from the state and stuff like that that join. So we are actively working with stakeholders to come up with pilots, programs, policies, ideas, or whatever that may look like. Lee and Caitlin, I really appreciate your presentation, and I can't wait to get a hold of that PowerPoint because there was a lot of really, really good stuff in there. So I appreciate that.
Echo, do you feel like they got to the things that like I assume that it's mostly parents that are filling out the surveys and coming to you, that you're hearing from youth and parents. Do you feel like this was comprehensive and addressed the kinds of things that parents are concerned about?
It did because like we're asking like for example, Like, do you think your youth vape? Does your youth vape? Do they have friends that vape? Where do you think they're getting it from? Are you aware? What are the sources? Have you had conversations with your children? So it's very detailed in a way where but we're also being realistic, like asking parents, right? Like, is there smoking in your household? Right? Because then that might also, there's probably a relational, ism between, people who live in houses where parents are vaping or smoking cigarettes and the short line between their youth participating in that, or maybe not feeling so ashamed or stigmatized because mom and dad, do it, so they might not realize how unhealthy it is, and that's addiction. So I know my twin specifically, when she was quitting cigarettes and going through that, she would tell her son all the time, "Mommy is addicted and she does not want to be. Mommy does not want to be doing this." So I thought that's also great, framing message. It's a very real message, for our youth that, we might be ashamed, we might be humiliated, but it's also good to take that power and say, I don't want to be doing this. And I would hate for you to be in that position to have no power or no control and to be harming yourself and not being able to stop. So I also thought that was a very powerful, vulnerable way to address things. And for her son, he's very like, you know, he's aware. He knows, oh, that could hurt me, and I don't want to, I don't want to be like that. Even though it's like you, I don't want to be like you. So, but yes, it's very thorough, and it asks about what you know, what you think you know, the connections in your teens, and just in general, if you have solid information that you can provide, also what you think. So it's very thorough.
I love that you said that about your sister too, because I think that's one of the risk factors. Youth can often feel invincible, right? Like they often feel like, well, this isn't going to happen to me, or this isn't this isn't something I need to worry about right now, maybe in the future. Like their decision making around seeing the future can be really impaired. And hearing from adults like, this is hard for me, I'm struggling with this, um, helps youth feel less stigmatized, I think. Um, and that's the truth. It's really hard to say, don't do this if you're doing it, right? Like, so we definitely have to have our own sort of houses clean before we're asking our youth for different behavior than we have ourselves. But we need to, all of this stuff, all this stuff. So thank you, Echo, for all the work that you're doing around this. And I know that you are doing so much work directly with youth, um, and helping them advocate for their own needs. That's really important. Getting young people involved in the advocacy and policy piece, I think, really goes a long way. Like it's powerful when you have youth show up for city council or school committee and say, this is something that we're dealing with and we're concerned about. That really makes people take notice.
One other thing I'll add, it's the last thing I promise, but I have said for many things, I am so glad I didn't grow up when vaping was around. That must be really hard. And just stop talking and get their reaction to that.
That's a really good one.
And also to answer the question about Lexington, I know that it's only for Lexington Public Schools, a specific program, but they have a website which is in our slides at the end for resources. They have a website where they have all of their resources too, and their different types of programming. Caitlin, I don't know if you like, I think it's only in Lexington that people use this program, right?
Yeah, so it's only available to students in the Lexington Public School system. And just to give some background, so I grew up in Lexington, so I've actually have had the luck of participating as a student and then came back as someone a little bit more educated and knowledgeable on things. So I've really seen, a full circle of this, which is why I really believe in this program. But so Julie Fenn is the one who really had spearheaded this program. She's been working for LPS for ages now, um, and has had all of these conversations year after year after year to develop this program. So when I was a student, it was education and health class, and then there's the peer education model. So students would participate. We had a SAD club at the high school, and so students who participated in SAD club and part of um, Julie's program would go into the middle schools to have conversations, mainly centered around what to expect as you move up into high school. But conversations around, what happens if I use substances? How do I say no? What are the stressors in life? What if I go to a party? And it was helpful because you're a middle schooler and you're getting to see all the cool high school students. And then you go enter high school and you're like, I'm going to be a part of the same program. And so that's how it kind of started. And then when I was there, and Leah came soon after I joined, um, we expanded the program. It was the peer leaders were like 100+ kids at the high school, and that's a lot. That's a huge youth group. And so now we're putting in programs, bullying prevention programs in the 4th grade, where high schoolers are going in and having these conversations. And all of these conversations, even though they're not directly related to substance use, they're all connected, in some aspect, and why someone may choose to use. And so I think if you're trying to develop your work with your school system and having these conversations on how to get, something better for your school system, I would start by recognizing the gaps, recognizing, as I had mentioned, like questioning what is the process of a student who's getting caught using on campus. What's the comfort level of teachers recognizing someone who may have a substance use concern in their life, and having those conversations. And then, okay, so someone was using, what's happening after they come back to school? Are we going to ignore it? How can we turn something that was a negative in their life into something positive? Let's give them back some power. Do you have a youth group that's concerned about the health and wellness of and it might be a mental health club. So focus on mental health. Let's start a campaign. I don't want to smoke because it makes me anxious. I don't want to do this because, or whatever the campaign is. Starting really small in those is helpful, so that you can then create larger impact. And then maybe in the future, if there's an adjustment that can be made into a much, expressive program, that could be helpful.
Any other thoughts or questions people have? If you didn't notice, there were lots of things in the chat complimenting what a great job you did and how helpful this was and how much people really appreciated the information. It definitely was striking to me that people were asking for this kind of information again and again, and that it's just not easy to find. And so we're so grateful that you both came here today to share all this with us. Because clearly the vaping companies are not leading the charge in getting the accurate health information out to people. So we're so glad that you are. Thank you so much. Kelsey, did you
Thank
have
you.
anything or see anything we missed or have anything to
I
add?
j I just put a request for feedback for the survey. It's a quick feedback survey in the chat. Um, and so we just request that folks complete that at their convenience. Takes about a minute or under. But really something that I pulled out from the talk and the training today was about some of the parallels to cigarettes in the past, right? Like Caitlin, I think it was you that mentioned, like we almost had it, right? There was a whole generation of folks that don't really smoke or use tobacco products, and then vaping comes on the scene to get around all of the work that had done about the harmful effects of tobacco, and that was a multi-pronged approach, right? It was policy changes, it was taxes, right? It was the education for kids in schools. I remember being a kid in the 90s, and they told us to work on our parents and our grandparents, like tell them it's not good to smoke around us, right? So then we had to go and say, come on, Grandma, really, if you want to smoke, you can do it, but maybe outside, really shouldn't do it near me. Um, and so though it was a multi-pronged approach and it was effective, right? And so I think about the parallels to vaping, and it's gonna require a multi-pronged approach and it will be effective, right? It's not an all hope is lost situation. Um, and when it's multi-pronged, it gives me the inspiration a little bit to say there's a role for everyone, right? So if policy is not your thing, focus on something else. If education doesn't feel like the right option, go for the policy or find whatever area it is that makes sense for you to plug in. Because whatever area it is contributing to the overall um, health of our community and especially our young people. Yeah. It was so great to hear folks talking about youth in such a positive and uplifting way. Like they're fighting these systems, right? Like all of this marketing is targeted against them, all of this, the peer pressure too. But there's all these bigger factors working against our youth. And so just recognizing that as we have difficult conversations and manage interpersonal relationships, right? Yeah. Thank you
Thank
so
you.
much.
That
Yeah,
was
those
such a
were the
beautiful sentiment to bring in as well, that this is an audience of people that are here because they genuinely care about the community and about our community's youth. We're not about punishing kids. We are here to do whatever we can to support. And I'm so grateful to live in a community of so many people that care about our kids. It's great.
absolutely.
Thank you all so much. We'll make sure and put the recording and all the resources that get shared up on our site. I know Caitlyn especially is welcoming reaching out to her if Leah has some a move in her in their future, so not as excited about getting involved in Massachusetts things right now, but please, reach out to Caitlyn and whatever we can do to make some social change and get better health outcomes for our young people and our adults is job well done. Thank you both so much. Yeah, Echo, thank you for sharing all the resources you brought to the table and all the support you've been giving for this issue and for our people, our youth. And I know my friend Barbara's here. She's always goes to school committee. She's with the NAACP. So this is another great issue that we can bring as an equity issue, as an issue that's really impacting our kids and that we need policymakers to pay attention to. Thank you all so much.
Thank you.
All right, we're calling it. Thanks again, everybody. Have a great rest of your day. Take
Be
good care.
well.
You
Thank
too.
you.
Thank you.
Thanks
Thank you.
again. Bye, guys.